I think right now. All right.
Okay.
Well, come back, everybody, to the Holistic Actions monthly Q&A webinars where we walk with you all along this path to pet wellness, where we show you how to work with your pet's bodies instead of working against them using antis. And Dr. Christina has something she wants to say about
Well, just and this may be for people that join later, but if any of you are here now, don't wait until the last 3 minutes to post your question. Post it now rather than posting it at the end, or raise your hand now. And to raise your hand, you go to React, and then you click on that, and it has raise hand, so you can have that. And the other thing is, for those of you who are here, at just before you start your question, if you would let us know if you are a member of Holistic Actions, because I will answer the question a little bit differently if you're already a member. And those of you who aren't a member can see some of the benefits that members have. So I cheated, they're close. Well, they are. I was on Hurricane Ridge there, Jenny. So I think that means that's what they were. It's not where I
wow.
am currently. That was I was visiting Jenny and went up to see the Olympic Mountains in Washington State. Okay, enough chatting. We usually have tons to talk about. So Steve, unmute yourself and you're on.
Well, good day, docs. Good to be on today. I need a second opinion. Can you hear me okay, by the way?
I can. Are you a member of Holistic Actions?
Sorry, I'm not, but I'm seriously, I love your Facebook page and what I've received in the way of emails, and this monthly Q&A is wonderful. So I'm seriously considering.
Super. Wonderful. Okay. So what's the second opinion about?
I had a consult with a holistic vet for my 16-year-old cat with diagnosed with hyper T, T463, free T4 over 100. She said that in all the years of using homeopathy, she's never seen it do anything for hyper T, and wanted to get your opinion regarding homeopathy's effectiveness.
Okay.
But that's the first question.
Sure. Absolutely. So who is the homeopath that your homeopathic veterinarian you're working with?
I only had a single consult with her, but she's her name is, I think it's Deva Khalsa.
Oh, Dava Kalasa. Okay. So I personally know Dava. She and I went to the very first veterinary homeopathy course that was offered by the National Center for Homeopathy in 1982.
Oh
And
wow.
she and I danced together when we all went out dancing with Dr. George McLeod, who was teaching it. Um, and she has she uses a lot of intuition with her homeopathy, and she also uses a lot of other modalities. And she's an excellent practitioner, and she is virtual. That's for everyone to know. However, I would not consider her the most, I can't say most talented, but there are definitely homeopaths who are having success treating hyperthyroidism.
I thought you'd even mentioned it on previous,
Yeah.
discussions.
So I've had cases where sometimes they responded and sometimes they didn't when I was practicing.
Mhm.
And Dr. Peter DeBias, who no longer has individual practice, but he did for decades, like I did. He spoke at the World Small Animal Veterinary Congress on hyperthyroidism, or maybe it was an AVH. It was at an AVH Academy of Veterinary Homeopathy conference. He spoke, and he was having excellent success if the cats were fairly newly diagnosed with
Mhm.
hyperthyroidism and hadn't yet been on medication. So he
Right,
was having pretty much 100% success with that. As they got more severe, then he might have less success.
right.
And so the approach would be you want to go to the Academy of Veterinary Homeopathy website or others. We have a free for everybody is if you go to holisticactions.com/select, And any of you on this call who do not already have a wonderful holistic veterinarian who you know is treating the underlying energy field imbalances, please go to that article to find, number one, somebody maybe who does Chinese medicine or chiropractic who's near you to be your hands-on vet on your holistic healing team, and a virtual homeopath that you can work with. So there's several websites for homeopathic veterinarians that are on that article. And the article is excellent to read, both to help you find veterinarians and also to help you know what you can do that will help the homeopathic veterinarian be the most successful with your animals. So I would go to the Academy of Veterinary Homeopathy, and definitely when you email them or speak with them, ask what their experience is, because different homeopathic vets do have, like I wouldn't treat cancer when I was a practicing vet for 35 years because I was traveling too much to handle any of the flare-ups that were so critical to be able to be handled.
Right.
So I didn't do that. So definitely, so the answer is yes to that. Next.
The other one is he had a pretty acute case 9 years ago, and I wasn't familiar with homeopathy, so I learned about I-131, and he was treated that way, and it worked. Other than being hypo for a few months, he normalized and was fine up until just recently. His symptoms are different, but what I wanted to ask you is, I'm really thinking about using it again, but I want more objective data because a lot of his symptoms are kind of paradoxical or not. Like, does he really have this? I mean, I know his diagnostic lab work said he does, but he's not acting at all like he did. He doesn't have loss of weight. He likes to be out in the heat. He has his temperature's fine, respiration's fine. It's like, what has he really got going on? So I was thinking about getting a thyroid scan using scintigraphy. There's not a lot of places to do that. What's your thought on all
So
that?
interesting. You saw the wonderful thing about holistic actions is one of our statements over and over again is there's no one right answer. And we often have speakers in our webinar series that you can access 7 years, 8 years of webinars of experts that disagree with each other because there is no one right answer. I shook my head and said, I don't think you need to do more testing. Dr. Jeff nodded that you should do more testing. So here's the thing. The joy, and you bring up a wonderful point for everybody to hear. Really good holistic medicine, whether it's homeopathy or excellent Chinese medicine, looking at the whole animal, is not dependent on having a diagnosis. And so we focus more on what the animal is showing us and what symptoms are present. And we look back through the history to see what's changed, what's new, because we're all going to die at some point. And what's important is quality of life.
Right.
And that's often a decision that's made with hyperthyroidism. Do we do iodine? Do we do holistic? Do we do surgery? What do we do methimazole? So that's the approach. So number one is you don't necessarily need to nail down the diagnosis right away. Your cat's doing really well right now. So I would say your first step is to do our 101 course, which will help educate you. That's free to anybody. And then you've done that. Good. So redo lesson 1, which is focused on the symptoms. It's not about the diagnosis, it's about the symptoms. And so find a homeopathic veterinarian to work with. And then you go from there.
I guess the reason why I was looking at this scintigraphy is because I was concerned about trusting the lab work as being, definitive for hyperthyroidism. Scintigraphy will tell you for sure if he's got adenomas or even a carcinoma or more, or where they are, the size, all of that, before you subject him to the radiation. That was my thing. You're saying I don't have to worry.
Well, I said not necessarily. I said you might want to start first. However, Dr. Jeff is much more up on all the testing side of it. So I want Dr. Jeff to respond, and you're muted right now.
Sorry about that. Mine was acting up. Yeah, Steve, I've actually done scintigraphy along with Mark Peterson, who's one of the
Right, Mark.
leaders that actually discovered hyperthyroidism back in the 70s. Yeah, if you were talking about a 12-year-old kitty or a 10-year-old kitty, I'd say maybe. And, it's an anesthetic procedure. There's a lot of stress involved in the traveling. And not sure at this point there's anything more important than what Dr. Christina said, which is focusing for the next decade, hopefully, on quality of life. My own kitty, who's about your kitty's age, has hyperthyroid, chronic kidney failure, and she's I have not done diagnostics on her recently at all, actually, in a couple of years. She drinks a ton. She's happy as all can get out, and it's basically as stable as they can be because, why do they really die from hyperthyroidism? It's they waste away, which your cat's not doing.
Oh, no, he's not.
They develop heart disease, which you can easily monitor at home. And again, like with Tiki, I would just focus on what are your kitty's joys? What does he love the most? Because that zone of joy is going to actually optimize his energetic balance better than any drug or remedy or anything can do. I will also go back and say that I think maybe David was talking about she's never seen a cat that had I-131 then go on to respond to homeopathy. And I would concur that after I-131, it's hard to treat. And usually we try to manage with combination of oral meds and homeopathy. But your cat, I would definitely focus on the quality of life picture and not worry about the diagnosis.
Yeah.
Unless you feel that you have to. If you feel that you'd be remiss not to, then you should do it.
Right, right.
But not for your cat's sake, for your sake.
And that's part of the other piece, of course, that you hear us talking about so much here is that your mental state and your emotional state definitely can definitely affect the animals. Not 100%. Some animals are just in a different place and
Right.
your state doesn't affect them at all. But it certainly is, your quality of life is important as well.
Mhm.
So, what Dr. Jeff is saying is if it's important to you to know that, then do it. And the homeopath you work with will also help you make that decision. It may or may not be something, it might be something that they say, wow, I think we need to follow up on that. Or maybe just repeat the straight blood test and not do the more difficult for the cat scan. So
Dr. Jeff, is the scintigraphy something that's stressful for the animal? Because I thought it was like pretty quick, and then
It's at least back when I was doing it, it was a anesthetic procedure in the hospital with an injection of contrast material that goes to the thyroid tissue. The answer to stress is, certainly anesthesia is stressful to the body, but the major stress is does your cat get stressed going in the box and traveling to the vet and getting manhandled and getting put in a cage and all that. I myself am a non-interventionist, so I try not to bring my animals, expose them to anything that would stress them out.
right.
But, again, it's really individual.
So
What you would feel the most comfortable with. A little stress may be worth it if it's going to make you feel better and make you spread true joy to your kitty. Because, like Dr. Christine said, our energetic balance does affect our animals. So I'm not sure it affects cats as much as dogs. Cats are kind of creatures unto themselves. But that's a different story.
One
Mike,
quick, one
go
quick.
ahead. Last one though, because we have to move on to other people.
So are you sort of recommending, because he's had this I-131 years ago, I think he became hypo longer because they might have given him too much of the radioisotope. Because he responded really well. Once he normalized, he was good. Are you suggesting that obviously it's up to me and how I feel and the stress on the cat, that it would be maybe better to initially use a homeopathic vet to see if the homeopathy could actually,
Yes,
you
I
know,
would at this point, as I said, and as Jeff sort of echoed, at this point, go for the homeopathic vet right now. One that says, yes, I've had some success working with, maybe not curing completely, but improving quality of life with a cat that has hyperthyroidism.
right. And I assume that means somehow managing the tumor size and keeping the thyroxine from,
It's where we're going
Right,
way into
right,
too many
right, right,
details, Steve.
right.
Sorry, we need to move on.
And most homeopaths will use the combination of methimazole at low doses along with homeopathy to manage the thyroid while their body is able to reduce it.
Okay, that's it, Steve. Jeff, that's it. Sorry. Sometimes people get upset with me that I'm sort of cut people off, but we already have 5, 6 people that have asked questions, and so we do need to move on. Now, that's the benefit of being a member is you can post in the forum 24/7, and we have plenty of time to answer you in great detail. Valerie, you're next.
I
You
think
said you hope you're doing this correctly.
Hi, I'm sorry. Can
Good.
you hear me?
Yes, I can
Can you
hear you.
hear me?
I can hear you.
Okay. Okay. I had a couple questions, just general and one specific. I have a great
No,
hearing.
Valerie, we can hear you. Your mute is off, but your voice is garbled a bit. Is it
Okay.
is it
I had
possible for
this,
you to type it in the chat?
I started to and I didn't get finished. I got confused on what to do. Let me try a different device real quick.
yeah,
Um,
I
you might want to go to somebody else and I'll try
Yeah,
a
you got a
different
bad
device.
echo. If you have a headset, if you have earbuds that you could plug in, if you can go get those and plug those in, it might help, and I'll call on you again.
Okay,
And then
thank
Bettina,
you.
okay, sure. Bettina, you're next. Bettina's a member, and she has 2 cats that are 13 and 14 who are doing well, and their blood work was great. And so now she's wondering if she needs to do it for take her other cat into the vet for a blood check because she doesn't want to stress them. And so, one thing I'd like to address here is for everybody, regardless of the age of your animals, one of the best things you can do is to train them to absolutely love going to the veterinarian. Now, at this moment, it's not an overnight thing, but it's worth it because, Bettina, your cats may live for a very long time, and so another 10 years at least. So it's definitely worth doing that work to get there. Now, Dr. Jeff, I'm going to let you answer should she go in for a basic blood test?
yeah, and we actually had this discussion on the forums. So the short answer was yes.
Okay. Um, does
Long
that do
as
it? Does
was
that do it for
depends
you? Or
on when it was done last, what it showed, and other. But
it
in
was
a
normal?
healthy geriatric that never had blood work, then yeah, it's a good idea to get a baseline. And why is that when they're not symptomatic? Because symptoms are internal as well as external. So in other words, the vet may find the blood test may find liver elevations or kidney elevations. And that is something that's gonna tell. Oops. Sorry. Wait, I just lost you're back. That's gonna tell you how aggressively you want to be working with a homeopath, energetically or another energetic practitioner, because I can promise you 100% that homeopathy and other energetic means are able to normalize any blood test abnormalities.
Unless there's
we
severe
see that all the
pathology.
time. Yeah. Yeah.
I mean, it's not
Yeah,
100%.
not all,
It's
not all, for sure.
possible. Yeah, possible and probable. So post again if you need a little bit more on that. And but it is really important to work with all three of your kitties so they get to love going to the pet. Sheila, Dr. Jeff, I want you to be sure you're reading that in the chat. A 12-year-old dog has thyroid of 0.6, and he's losing weight, has hair changes, periodic diarrhea, diagnosed with GLOP, and wondering if a full thyroid should be done. The most important, and I thank you, you did a good job on your phone to do that. You're going to hear, all of you who are new to this are going to hear this over and over again. Regardless of the diagnosis, a homeopathic veterinarian and a really good Chinese medicine veterinarian, chiropractor, etc., will be able to treat any problem because there's an underlying energy field imbalance that produces all of the symptoms. So the weight loss, the hair changes, etc., the periodic diarrhea and vomiting will all be treated with one treatment, one remedy, and then maybe another one's needed if that didn't work, and maybe another one, but sort of one at a time. Or with Chinese medicine, they'll diagnose the whole pattern when it's done properly. They'll diagnose the whole pattern, use tongue and pulse diagnosis, that sort of thing, and can treat everything. So it's not as critical to actually have the blood work done. Any other comments on the numbers there? And a dog?
Hard to comment on a resting T4 if they have the blood, or, if this was just run, your vet can easily add on a free T4, which would be more of a confirmatory test.
Okay.
But rarely will we see a dog with hypothyroidism losing weight. They usually do just the opposite.
Right.
And I do have one question, Sheila, and that is, what's GALP?
Oh, I'm sorry. Geriatric onset laryngeal paralysis and polyneuropathy. It's a mouthful.
So Sheila, for your dog, I would put together a healthcare team that, if possible, includes a chiropractor, a physical therapist, and some of these the physical therapy people, rehab people work virtually. Homeopathy has been really good with laryngeal paralysis,
Okay.
reversing that, or at least having it not progressing too much. So I would definitely be going for homeopathy, really good Chinese medicine, and seriously suggest becoming a member because you can keep posting on the forum.
Okay.
Every time you have something new. And also a member benefit is the Healthy Dog Journal or Healthy Cat Journal. And if you don't become a member, you can purchase them from my website, which is my name, ChristinaChambreau.com.
Okay.
And that way you can track, you've got so much going on
I
that it
know.
would be important to track it, being able just to use numbers from the master symptom list. So that would
Okay.
help.
Thank
Does that
you.
make sense?
Yes,
Okay.
thank you.
You're welcome. Okay. Valerie did post. She has two dogs. One's a 3-year-old Great Pyrenees. The other is a 20-month-old. She cooks half their food, bland beef, turkey, chicken, pork, various veggies, and the other half is high quality kibble. So question is, stop the kibble. Or question is, why do you think you need to give kibble? And if it's because you're gone and have somebody, every week you're gone 50% of the time and somebody has to feed them during that time and they'll only feed kibble, well, maybe you have to do that. But consider kibble as dog crack or dog Cheerios, less healthy than Cheerios. What's the sugary one? Sugar Pops. And then the second thing is to start playing around with different ways of preparing food and tracking how they're doing with it. There's no one right way to feed dogs any more than there is to feed people. So some people thrive as a vegan, some people do horrible. Some people thrive as keto or paleo diet, others don't. And the key in feeding dogs and cats is variety and thinking about what their teeth and digestive system, their mouth and digestive system are set up for. So if you do the 101 course that we have, again, that's free to anybody, we have a whole section. Lesson 2 is all about nutrition. And then you can go to the forum and actually read the forum and see different posts that have been made. And there are some books and guidelines on that. And if you want, to dig in more, I do pet health coaching, which could help you more with that. So you can do that. You can go to that through my website. Hopefully that helps. And Dr. Jeff, do you know about Dogzyme's Bone Builder?
I don't know. I know Dogzymes. I don't know the Bone Builder.
That sounds like an interesting one. I think
I have to look it up.
I think we'll have to check that out. Okay. Allison, and if you have another question, if I didn't quite answer you, Valerie, if you can just repost. And the way to find a holistic vet in rural Northeast Georgia is to go to that website that Dr. Jeff put in, holisticactions.com/select. Read the whole article. I would write down Kim Parker, and she'll be speaking for us towards the end of this year. So you can actually hear her on the webinar if you were a member, if you became a member. And she's Atlanta, but she's sort of northern. She's like a little beyond. So she might be one for you, and there might be somebody closer to you. And that article will help you find one. Allison, should I be concerned if I haven't given my 18-month-old dog his rabies shot yet? Small dog, big dog, runs loose where he can get bitten by a raccoon, never out of your sight, stays in your arms, hopefully not all the time. Couple of questions on that. But legally, you can run into trouble, of course. Legally, we recommend that animals stay current on their rabies vaccine unless they're in the midst of a super chronic disease like cancer or really severe ailments, where a holistic veterinarian could give exemption, depending on the state and depending on the township. So the possible risks are if your dog, and it's a young dog. So I guess before I go to the caution, it's if you are following our guidelines, the general guidelines for good health, feeding a great diet, avoiding toxins, avoiding other vaccines, doing plenty of mental and physical stimulation that's appropriate for that dog, and really the puppy is healthy, most of them, except with rare exceptions, most of them do fine with the rabies vaccine. You're not giving them 10 vaccine, one vaccine that has 6 things in it and 5 other ones. And if they do have a problem afterwards, homeopathy, Chinese medicine, energy healing, there are multiple ways to usually fix the problem. The concern about not having ever gotten a single one is if your dog bites somebody else, he will have to get a rabies at that moment and have a 10-day quarantine. Usually it's actually it may not be if they bite somebody, but depends on the local township. And the second is if he gets bit by an unknown source, he's out in the yard and comes in and has what looks like a bite wound on his butt, then with no vaccine ever, and again, depending on the local laws, he may be facing euthanasia or a long quarantine, 4 to 6 months. A person in Baltimore had a cat, 17-year-old cat, who was 2 weeks overdue for her rabies vaccine. We don't recommend doing it to an indoor cat that's old anyway, but she had a bat in her house. So she asked animal control to come get the bat. They saw the cat and they insisted on the cat being in a cage in the window for 6 months. Now, she figured ways around that, but it's worth doing it, bottom line. Bettina asks, are blood tests always accurate? Nope. And if they don't fit the pattern, it's definitely worth repeating them. And also you have to remember, and Dr. Jeff talks about this a lot, and again, is the trends. It's not necessarily the blood work for today, because what the dog eat, is the dog cat stressed, what's going on, that can really shift things. So it's more over time, the trend, and why. Is there, is anything else? Are there symptoms? Is anything going on?
Yeah, and I just put my forthcoming book waitlist in there because we talk a lot about how the
Right.
trend is your friend. Whether it's a trend in beam, whether it's a trend in blood work, it's just remaining mindful and conscious of everything going on. And, you can definitely either work with the vet or somebody else that can help you put everything in context. So, and I would love, certainly, everyone that jumps on that wait list is going to get, it comes with the first 20 pages of the book, you'll get a preview so you'll know the direction that we're talking about.
And if you want to buy the book when it comes out, because you'll know you'll want to buy the book when it comes out. Mary got a lot of great responses to her question about, one cat attacking another and debating, should I give it away or not? And there definitely, sometimes animals do need to be rehomed. It just doesn't work. They may need to be in a house with no other cats, a house with dogs. Sometimes that has to be done. However, working with an animal communicator is good. And if you become a member, you have access. We've had a lot of animal communicators speak. If you can find the website for Penelope's, it's, I'm drawing a blank.
Animal talk.
Animaltalk.net or com, just double check. If you
Yeah,
can double check.
yeah.
Penelope Smith has a wonderful, she's one of the original animal communicators who actually spoke to the Veterinary Association in the early 90s. And I heard her then. And she has a roster, and people who get on her roster have to sort of sign a pledge of how they will function. Doesn't mean they do necessarily, but it gives you a good place to begin. And of course, they do work virtually. Bettina, if you're a member, you just put Dog Journal in the search when you're in the resources library page. And if you're not a member, you go to my website and click on, I think it says books, and then Healthy Animals Journal. And then in there is the ebook, or you can get a print copy, whichever you want. So Allison, there's no problem. Oh, we answered that one already, right? Yeah. Okay.
Yeah.
So we did that one. I thought maybe it was the second one with a similar question. Yeah, so we've answered that. Valerie's other question is, an ear infection was treated prednisone. She had a terrible reaction. So I would, number one, stop the prednisone. Oh, she's finished them now. Okay. Anytime there's a negative reaction to a drug, to a homeopathic medicine, to an herb, to a flower essence, to an essential oil, to anything you're trying, stop right away and then get back to whoever prescribed that, or, work with people, find somebody to help you with that. So ear problems are a very common issue with children and with dogs. So frequently, dogs, especially dogs are, especially floppy-eared dogs, have repeated ear infections over and over and over again, to the point where lots of cockers get their whole ear ablated. They just cut it off. And so that's definitely not something that you that you want to have happen. With children, they get repeated ear infections and then they have, I don't know, tubes put in their ear and things like that. So it's really important for everybody here to remember that something may seem minor, but if you can treat it first holistically, if it doesn't respond, then you can move on to deeper treatment. Now, the fact that she's still not back to normal, there's feeding a fresh food diet, the very best food for her, would help her get back to normal. Plenty of exercise will help her get back to normal. Maybe lots of good grooming and massage would help her get back to normal, because you said not entirely. So it seems like she's moving in the right direction. There are flower essences that are related to irritability and anxiety that you could use, because it may be, see, we have this underlying energy field imbalance. And for her, the balance, she was sensitive to a drug. And so that pushed her energy field off balance to produce the anxiety. So the treatment, the best treatment would be homeopathy, Chinese medicine, because it would address the fact that there was an ear problem, and the anxiety and irritability, and the fact that it was a drug that it was triggered by a drug. And all of those will be resolved with the proper treatment. There, I don't know, anything else, Jeff, just off the cuff for, not for the anxiety, but the prednisone's out of her system already because you were giving pills. So it's not that it's there, it's just that it was pushed off balance. And again, we can go much more into that in detail. I'm going to skip to, I keep forgetting that there's these different tabs up there. So I think it's about time for Adrienne. And yeah, so she's been brushing her kitty's teeth. If the cats don't mind having their teeth brushed, it's fine to keep doing it. It is fine. We had one of our speakers said you can just rub their teeth like this. And I asked my personal dentist if I could do that. And she said, yes, absolutely. And with people, we still need to floss. Dogs and cats, their teeth are so far apart, you don't have to worry about that. So you can do that. And just pay attention. We had another speaker recently that, particularly with dogs, you'll see this, that their back molar will get a fracture on it if they're eating bones that might get missed because tartar might build up on it. So this is part of having your dogs and cats love you to do physicals on them. They want you to say, okay, come on up to the table where we're going to do your physical. And so that you can, really open their mouth and look, that you can clean their ears out and they don't care. They hand you their paw to have their toenails trimmed. For some animals, it's a lifelong learning. But for most animals with patience, you can get there. So yes, you can just use your finger. Don't even need a gauze pad. Or keep brushing if they're okay with that. And most cats and dogs do fine with dentistry. The anesthetics now are very good. I don't know how long ago in the past that was. Silvervine is like catnip, and it's just a fun thing. Some cats don't like catnip, but they like silvervine. Kelp is very good just as a general health booster for any animal, because our food doesn't have a whole lot. Kelp is not going to cause thyroid issues. And I'll let Dr. Jeff check on the, whoops, oh my gosh, where am I? Check on that link. And Adrienne, if you would post in the main chat, if you have another question, that'd be great, because I forget to go over to the side chats. I'm getting better at this, but not there yet. Bettina, do you remember what she's feeding, Jeff? Oh, here, they get raw meat, mostly. So again, difference of opinion. I think it's absolutely fine to feed fish as part of the diet, feeding it sometimes. Dr. Jean Hovey feels you shouldn't feed fish to cats. So it's a difference of opinion, and it's just good to do a variety of foods. So you are feeding meat, but how about feeding organ meat? Are you feeding heart, kidney, liver? That could be important. An added variety to them. Now you say, so the stools are hard when there's a little bone in their diet. So maybe you're doing too much bone, or for the calcium, which is critical. Everybody here feeding fresh food, you must feed calcium, either bones or a calcium supplement. And one of them is calcium from algae. It's a white powder. You might want to try that one and see if it's a huge container, but it would be worth a try. Or try eggshells, powdered eggshells, or you can buy eggshell powder, rather than bone meal in this case, just since you've already had some problems with that. And in terms of, that's about it for me. And Dr. Jeff, I think you're okay with feeding fish some to cats.
I am, and I love sardines. In fact, the kitty I was just talking about who's gotten very skinny due to sarcopenia, which is an old age muscle wasting disease. We're about to make her a sardine slurry with the whey protein to try and get some weight on her. So yeah, I mean, sardines are a good thing to add to the diet, in my opinion.
Okay, Mary Rush. So good resource for making healthy, nutritionally balanced cat food is number one. I got distracted by a text coming in, sorry. So number one, make sure you take the 101 course if you're not a member. And if you are a member, be sure you take the 101 course. Many people forget to. And the second lesson out of 5 lessons is about feeding in general. And then one of our faculty members, Dr. Jean Hovey's website is littlebigcat.com. And she has a book on feeding cats. And Dr. Karen Becker has a book, Dr. Becker's Guide to Healthy Food for Dogs and Cats, or something like that. And she's really good because you don't have to, it's not saying do this recipe. And the bottom line in terms of feeding is to feed a wide variety, and preferably you get the ingredients yourself and put it together. And we've had many, many speakers on this, some who agree with that, some who don't, some who say you need to work with a nutritionist to do that. And so we definitely there's as much out there, as I said before, for animals as it is for people. In terms of probiotics, there's no one supplement that is the best. And it's most important that regardless of which ones you choose, whether it's a vitamin mineral supplement, a probiotic supplement, any of those, that you rotate them. And if they're perfectly healthy and doing well, you have to make a judgment as to whether you want to be giving any supplements at all. So a healthy gut shouldn't need probiotics all the time if they're on a fresh food diet. However, healthy animals might need some supplements like whole food supplements, because our soils and air and all of that aren't that good. So they might not be getting all the vitamins, minerals, essential oils that they need. There's no one right answer for that. No side teeth. I'm amazed at what cats can chew. So all you have to do is try. And it's a good point for us to bring up, is to feed sometimes, at least during the week, doesn't have to be every meal, that you feed the biggest chunks your animal will eat. A couple of dogs, I was lecturing at UC Davis vet school, and the vet student who was hosting me had two big dogs, 50, 60 pound, and she was waiting till I got there to try feeding raw food. So we went to the health food store and we bought a stewing chicken. So they're pretty big and hard bone, you know, big bones. We cut it in quarters. So people who say, oh, it takes a long time to do that. Nope, that's how quick. It was just cutting it in quarters. And then we handed each dog a quarter. Didn't do anything to it, just so very easy. The one dog picked it up and it never touched the ground again. It was like a snake eating food. The other dog took 20 minutes, licking, nibbling, chewing, finally finished it. Day 2, it was as fast as the other dog. So again, the biggest you can do is great. Christine, I guess why are you rubbing coconut oil on your kitty's teeth and your pup's teeth? If you're feeding a species appropriate diet, you shouldn't need to do that. And there's no problem with doing it. Now, if there are problems in the mouth with the gums or something, then you might want to be looking, you know, then that could be a possible thing to do. Coconut oil is great in general for many, many things. And again, repost if on my website, Bettina would recommend going to Penelope Smith's site. She's got so much more than I do. I have on my on my business website, ChristinaChambreau.com, I do have a list of animal communicators with some comments by each one. And Christine's mentioned Hanna Makinen, who's one of we've had her speak for us several times. And, but we don't have a specific list on our website. If you're a member, then what you would do is or if you become a member, you'd go to our resource section and in the search, you would put in animal communicator. And that would get you everything everybody's talked about with animal communicators. And so you can actually listen to them. Kate Solisti, I mean, we've got, there are a number of ones. Solisti, I'm not doing it right. Can you put Kate's in? I can't spell it right. And the calcium supplement is by Animal Essentials. And it just says calcium on the bottle. And you can get that on Amazon. And it would say from algae on it or from seaweed. I'm not sure exactly what it says. Well, and Bettina, that's fine. If she says, if I give 2 big pieces of meat, my cat tries to chew it a little, but gives up and just swallows the meat. You want them to chew it a little because see, that's what they're doing. What they're doing. Oh, this is fun. I get to actually do this, Jeff. This is fun. So what you want them to be doing is, I happen to have a beet left. Because as they do that, they're cleaning their teeth by sinking their teeth into it. So even if they chew just a little bit, it's still going to be getting there. And what you might want to do is try a bigger piece. Obviously, if she can swallow it, she's gotten it small enough to swallow. Eating grass, dirt, and moss is an ongoing. Why don't you answer that one, Jenny? You've probably got an opinion on that too. We have many opinions that over my 45 years and Jeff's 40 years of this, even within the holistic community, why do animals eat grass, moss, and dirt?
Can I go first?
What?
Can I go first before?
Sure.
Because I know why.
Oh, okay.
They like it.
And
I watched my half an hour ago before we started just going from grass to grass. And she just, her joy smiling the whole time.
So if an animal goes out and eats dirt cravingly, Like every single time they go out, they're inhaling dirt or licking cement or licking photographs, or that's what we call pica, P-I-C-A. And that indicates that the energy field is off balance. And so something needs to change. It usually doesn't mean something missing in the diet, but occasionally it could be that. So you always do play around with diet anytime there's a problem. You can experiment with changing what you're doing diet-wise. But Juliet de Berkeley-Levy, who wrote the Herbal Handbook for Dogs and Cats, or Dogs and whichever, there might be two of them. She talks about, she died at about 102, just this brilliant, wonderful woman, gypsy-like, who traveled all over Europe and watched her big dogs. She had sighthounds, Salukis, I think. And every spring, they would go out and they would even eat toxic plants and then throw up. And that was them cleaning out their system. So they knew what they wanted to eat. So moss and not so much dirt, but moss and grass and even a little bit of dirt have microorganisms in them. And that's good for their gut. Maybe Christine's answer of giving some fermented vegetables would be a really good idea. I like that. And of course, when you're feeding a raw food diet, they've got a little more live in it. So feeding partially cooked, partially raw can also be an approach. Oh, good, Dr. Jeff. Christine has a list of communicators on her site. I have to remember that. Whitney, my girl eats everything. Good for you. I've loved seeing you grow, Whitney, in all the years you've been with us, from worrying a lot to not worrying about a lot of things. That's wonderful. And that is, again, we talk about this, and our speakers, our experts have over and over again emphasized that our worry really makes a problem. Can make a problem for them, and it certainly makes a problem for us. Mary asks, why does her cat lick her a lot? And why do dogs lick people a lot? Because they like to. Usually.
They love you, and they're kissing you, and yeah, they may like the salt if you're sweaty, or water if you're wet, or It's
now,
usually not a problem.
Except for sometimes the people like me. I've had friends that had dogs that licked, they loved it. They encouraged it. But when we were sitting in the hot tub together, I trained that dog not to lick on me. He could lick on his mom as much as he wanted, but not me. Allison, how can I figure what's off? What's she asking about, Jeff? You've got a better memory than
Maybe
I.
referring to the eating of dirt.
That wasn't Allison.
That wasn't Allison.
That was,
don't know.
oh, it was Allison. Yeah. Okay. So, how can you tell what's off? Just experiment, explore. It's not critical. It's not, it's not causing a problem. So experiment with a different diet. Try feeding raw for a while. Try a probiotic for a while. Try some supplements. One at a time. Don't do it all at one time, because then you won't know what's what. Bettina, I'd have to look it up. Do you have off the top of your head? The calcium supplement depends on which one you're using, and if you're buying it commercially, it'll tell you, and it's per. You have to pay attention when you're looking it up online, or again, if you're a member, you'd post that in the forum. Sometimes they say how much per pound of meat, sometimes, which is the most accurate. That's what you want, because why are you feeding calcium? You're feeding calcium because in the wild, they eat meat and bones, muscle and bone. Muscle's high phosphorus, bones high calcium. You need it balanced. So if you're not feeding bones, then you have to give calcium to mimic what they would be getting from the bones. And I think we actually did a great job And with everybody answering questions, we actually answered all the questions. And thank you for everybody who contributed to your answers. Do you know offhand amount of calcium per pound of meat or something?
I think it depends on
Yeah.
the product. I only use eggshell calcium, and I think it's a scoop per
Yeah.
pound. But I just had one question before we left, and that is for Whitney. Whitney, did Siren get high off the joint she ate?
Oh,
Whitney?
she ended up at the vet. It was pretty bad.
Oh,
Oh, darn.
Not
just
good.
one joint?
Well, we were in the park. Actually, she was with Dana, my friend Dana. And we assume that's what she ate. We're not 100% certain. But
Uh,
there's a video of her and she's like, it looks like she's stoned and she had to have fluids and but she recovered, she was home within 3 hours. But it just took a while for her body to get rid of it all.
What a great point, though, when you're walking in the park.
Yeah.
Picking up a cigarette is one thing, but what's in the cigarette? I might not have thought about that.
Yeah.
Wow.
Yeah.
Excellent.
all
Okay.
right. Well,
And
why don't
again,
we?
Cindy, it's 10:30. So the best way to prevent another occurrence, Cindy, is to go to holisticactions.com and take the course. Read the course, feed a fresh food, all the stuff we've talked about. You may not have been here the whole time, but that's what we would need. Okay, next month, same time, same place, or if you come to the webinars, you can post questions like this in the chat, regardless of what our topic is. And Dr. Jeff's new book, when it comes out, is going to be covering a whole bunch of the stuff that we've talked about here.
For sure. And thank you for reminding me to put that in the. Nope, that wasn't
You
it.
did,
All
you
right,
did
never mind.
once. Yep.
Yeah.
All right.
But so we'll see you all in August for our final summer Q&A webinar. Have a good weekend. Thanks. Bye-bye.